Today, we're going to break down a really fascinating new study. It takes us to a rural community in Jammu, India, to tell a powerful story about mental health. But here's the thing, it's a story told not with anecdotes, but with hard data. All right, let's dive in.
But let's start with a question for you. How much does where you live really shape your mental well-being? It's kind of the central question of this whole study, and believe me, the answer's way more profound than you might think.
So, to really get why this research is so important, we have to start with the big picture. We're talking about what the study's authors call a hidden health crisis that's happening in many parts of the world. You know, we often think of health as just our physical bodies, right? But the World Health Organization sees it so much more broadly. And this quote really gets to the heart of it. Mental health isn't just about not being sick. It's a totally fundamental part of our overall well-being. So here's the problem. Even though we know that's true, mental health in a lot of rural and underserved communities is just a total blind spot. Researchers had a decent handle on mental health in big cities or even conflict zones in the region, but there was this huge knowledge gap when it came to rural Jammu. So a team decided it was time to fill it. So how exactly did they do it? How do you tackle a knowledge gap that big? Well, let's go inside the Jammu study to see their game plan. Okay, so the team went to a place called R.S. Pura, a rural area right near the India-Pakistan border. And they didn't mess around. Trained investigators literally went house to house, conducting these really detailed interviews with over 1,000 adults, all between 18 and 60 years old. The goal was simple but so powerful. Figure out just how common psychiatric disorders were, and then see what other factors might be connected to them. And what they found? Well, it was significant. This is where the data really starts to paint a picture. 20.67%, that was the big headline number. The overall prevalence of psychiatric disorders they found in the community. To put that into perspective for you, that means for every 5 adults the researchers sat down with, 1 was identified as having a psychiatric disorder. That's a huge public health finding. But what did that actually look like on the ground?
Well, when you break that big number down, one thing just jumps off the page. Alcohol dependence. It was affecting over 12% of the entire sample. After that, you see generalized anxiety disorder and depression, but at much, much lower rates.
But hold on, because that 20% average is actually hiding a much more dramatic story. As soon as the researchers split the data by gender, a completely different and frankly shocking picture emerged. Just look at this. The overall rate for men was nearly 32.5%. For women, it was just over 10%. That means men in this community were found to have a psychiatric disorder at a rate more than 3 times that of women. I mean, that is just a staggering difference. But wait, it gets even more nuanced, because while men had those higher rates overall, it was almost entirely driven by substance and alcohol use. In fact, in this study, alcohol dependence and substance abuse were found exclusively in men, 0 cases in women. On the flip side, things like generalized anxiety and depression were way more common in women. It just goes to show how gender can shape not just if you face a challenge, but the what and the how of that challenge. So, this all begs the question, right? Why? Why these numbers and why these massive differences? The next part of the study tried to answer that by looking for connections, what researchers call risk factors. First up, this number, 7.7 times. Any idea what that might represent? It's the increased odds of having a psychiatric disorder for people who were illiterate compared to those who were college graduates. The study found this incredibly clear, strong link. The less formal education someone had, the higher their risk. And here's another really powerful one, 5.1 times. This was the increased risk for people from the lowest socioeconomic class compared to those in the upper middle class. Again, a super clear pattern emerged. Economic hardship was strongly associated with a higher rate of mental health disorders. And the data kept revealing these powerful links. For example, older adults were nearly 4 times more likely to have a disorder than younger adults. And people who were widowed or divorced had almost 5 times the odds. But the connection to physical health was, well, it was undeniable. Look at this last stat. An incredible 85% of people who were dealing with infertility also had a diagnosed psychiatric disorder. So all of this leads to the most important question of all. What do we do with this information? because data is only powerful if it actually leads to action, right? If this study tells us one thing, it's that mental health does not exist in a vacuum. It just brilliantly illustrates how deeply our well-being is tangled up with the social, the economic, and the physical realities of our lives. So, based on everything they found, the researchers proposed a really clear path forward. First, integrate mental health support right into your regular doctor's office. Next, create community centers and even mobile clinics to make it easier to get help. Then launch campaigns to fight the stigma. And finally, offer targeted support for the most vulnerable groups, like people with chronic illnesses or those facing huge life stressors. And that kind of brings us full circle, back to where we started. We just broke down the story of one community in rural Jammu, but its lessons are pretty universal. It leaves all of us with a question to think about. What are the factors that are shaping well-being in your community? Thanks for tuning in.